All right. It is time to get into our amazing guests. And I have all your credentials over here. And if I mess them up, you guys are welcome to just say, Troy, that's not what it is. All right. First off, we have Dr. Todd Broder, MD, board certified adult and forensic psychiatrist, not psychologist, psychiatrist, co-owner of Florida Center for TMS, medical director, mental health service, UF St. John's at Flagler Hospital. And we also have in studio, prettying up the studio with her beautiful face, Lena Russell, psychiatric nurse practitioner at SMA Healthcare, psychedelic assisted therapy, yoga instructor, and founder of Light Triad or Triad. We're not sure which way we're saying that. Wellness. So welcome, guys. I appreciate you coming in. It's Mental Health Month. And, first off, tell me the difference between a psychologist and a psychiatrist.
Sure.
And don't just say because they're better looking.
No, thank you so much for having us. Any opportunity we have to bring mental health to the forefront and bring awareness to mental health is always a great thing. So thank you so much for acknowledging that and having us both in. This is the most common question. What is the difference between a psychiatrist and a psychologist? Obviously, we work in the same field and hand in hand. Simply put, psychiatry is a subset of medicine. So I went to medical school at University of Florida, finished that, and then subspecialized in psychiatry for a residency. So most psychiatrists will focus on medication management and prescriptions, whereas psychology, and there are varying degrees of psychology, they focus more on the therapy component of mental health.
Okay, thank you. Because I always confuse those. I mean,
they sound similar.
Yeah. So, and Lena, I got to know. It says just the word psychedelic automatically draws your eye in. So, can you tell me a little bit about psychedelic assisted therapy? Can you give me a brief description of what that is?
Sure. So, I mean, there's a ton of evidence these days to say that psychedelics can really be so beneficial for mental health disorders. For example, like depression, anxiety, treating substance use disorders. So it's a really fast kind of emerging field. And psychedelics really can range from things like psilocybin, MDMA-assisted psychotherapy, and ketamine, although that's not technically a psychedelic. And really, psychedelics have been used for thousands of years by humanity. And it's kind of just about now that the medical model is catching up with that. Really, really interesting field.
Okay, and I know you two personally, and I know you have a love for what you do. So I'm going to start with you, Lena, and then Dr. Broder, I'll come back to you. So what drew you into the occupation of mental health? Because it's not an easy occupation. It's not like the low-hanging fruit.
Yeah.
So something had to kind of push you into that. So what kind of drew you into mental health from your personal side?
Yeah, that's a great question. I'd say probably I was in the army, actually, the British Army, as a medic a few years ago.
Is that what that accent was? I thought it was Alabama.
I'm not a Florida native, no. So, in my time in the army and after the army, I think I, encountered a lot of issues with mental health disorders of others and to an extent myself after being in the military. And it kind of sparked my interest in mental health overall, and then in psychedelics ultimately.
Kind of attached to it and just stay with it.
Yeah.
Dr. Broder, what about you? I mean, everybody's journey is, everybody kind of ends up at the same spot, but everybody's journey is a little bit different. What drew you into that mental health?
Yeah, it was somewhat sideways for me, Troy. I went into medicine to do oncology, work with cancer patients.
Yeah.
It was a childhood experience with cancer personally that drove me in that direction. And I was at University of Florida, and I was doing a rotation up in Jacksonville, and I was working in this shelter inside of it was a clinic inside of a homeless shelter in Jacksonville, the Salzbacher Center. And we had this little
still there.
up,
They do amazing work.
yeah, amazing place. And we had this little minivan, like an old minivan. And we were riding around downtown Jacksonville and bringing bagged lunches to chronically mentally ill and patients living with schizophrenia, trying to get them into the clinic. And I just fell in love with it. Fell in love with the art of psychiatry, and particularly with forensics. I started to get very interested in. I started working with a psychiatrist who was doing teenage serial killer work, and I got real interested in the forensic side of things. And I just pulled the trigger and moved in that direction. It was the hardest phone call I had ever had to make when I had to call my parents, who helped me so much through medical school. And I said, "Listen, Mom, Dad, thank you so much for everything you did, but look, I'm not going to be a real doctor. Bye."
You're a real doctor.
Yeah.
You're a real doctor. Right? I mean, it does say MD beside your name, but I'm sure that was the challenge, because I mean, what you went through, I think it was in high school.
Yes, I was 17 years old.
You're 17 years old when you went through that. I kind of know a little bit about the story, but we talked a little bit about cancer and the trauma that puts on people. But today, compared to you've been a psychiatrist now for over 20 years.
Correct.
Okay. Today, it seems more acceptable to say, "Oh, I'm going to see my psychiatrist or my therapist," even 20 years ago. And when I was a kid, back in the 70s, it was like, you whispered it.
Right.
You didn't even say it. You didn't say it on a format like this. You whispered it. What do you think has allowed that acceptance over the past few decades, where it's like it's expected? Hey, it's okay to have these mental health things.
Yeah.
So what do you think that change in acceptance has created?
It's been an uphill battle. I think the mental health field has been working very hard to create awareness and parity. I think also social media and access to information has made it much easier to spread the word and for people to communicate about these things. And I think the growing prevalence of psychiatric illnesses, we have tripled our rates of depression since the pandemic. I mean, tripled them. Depression is now the #1 cause of disability worldwide. So this really has become a monster that is impacting so many of our lives, either directly or indirectly. So it's been multiple forces combining together to really bring this awareness and be able to have these open conversations.
Yeah. No. I mean, like in my house, we have a neurodivergent house. Okay, I think that's the correct term for right now. I think it changes about every 17 weeks. But I live with 4 neurodivergent people, and I'm supposed to be the neurotypical. Yeah. I think it's opposite in my house.
Perspective,
yeah, that's exactly what I was going to say. And so one of the things that we talked about, depression, but anxiety seems to be through the roof right now in our society. What are some of the differences of how, because you guys handle situations a little bit differently. Can you tell me the differences, and Lena, I'm going to start with you on this one, the differences between how you two handle certain situations with your position and with Dr. Broder's position?
Sure. Well, I mean, I think there's actually quite a lot of overlap between how we approach things. And one of the things I really appreciate about Todd is that he doesn't just look at, a condition and then treating it with a medication, and that we, both appreciate the benefits of things like exercise, nutrition, sleep, social connections. There's so many aspects to treating any condition, such as anxiety. So for me, when I, for example, have a new patient who comes in with anxiety, I really kind of look at the fundamental cause of that, rather than just saying, okay, you have anxiety and there's a medication for it. So just so many things that can contribute to that. Like I said, diet, exercise, sleep, so many different things. And ultimately there's a lot of different remedies and not just medications.
Yeah. See, I'm not a guy who sleeps.
Yeah,
everybody needs.
I can help you with that. I have a whole sleep tips sheet.
Yeah. Everybody gets like 6 and 7 hours sleep, and I'm like, that seems like.
We'll chat after this.
Yeah.
I'm big on sleep, and sleep is just so fundamental to mental health, physical health, and that's the other thing,
Where were you 30 years ago? When I've never been able to sleep. So
I was 10 years old then, so not in this field.
Okay, now you're being hurtful. So, but Dr. Todd, like an anxiety, how do you see? Obviously, you guys have different personalities. Each individual is going to be different. The approach of, is there a patient that comes to you and you go, okay, you're better suited if you talk to Lena and how she handles it. How do you handle that portion of the anxiety side of it?
So I couldn't agree more with what Lena is saying. Anxiety is a broad word, and it's a series of symptoms, often of other circumstances. Sometimes those are life stressors and life circumstances. Anxiety could be a symptom of another mental health disorder, such as depression. Those things can be very linked together. Lena and I work in different settings. So she works in an outpatient setting primarily, often working with chronic and severe mental illness. I do have a subspecialty outpatient clinic where we focus largely on depression, but I also work on an inpatient unit. So I'm often treating patients in a very acute episode, and I'm trying to get that episode stabilized and get them moved out into an outpatient setting. So we have slightly different approaches to things often, but again, a lot of overlap. I also agree that I think we've gotten too much into a culture of, here's your diagnosis, throw a medication at that. And we really need to step back and look at whole mind health and wellness. And honestly, the data on exercise is so profound that it's malpractice not to prescribe it. And too often you don't see clinicians doing that.
Gotcha. Because I mean, that creates a natural dopamine, which kind of balances your body, correct? I mean, just getting outside in the sun even changes a lot of how you feel. Now, Dr. Broder, you came to St. Augustine about 15 years ago. When you were here at St. Augustine, can you tell me about the transitions? Because a lot of people are confused about how the transition worked from the one hospital to the other hospital. You were involved. You've been here throughout the entire time. And talk about the program, where it was at when you got here and where it is now.
Yeah, absolutely. When I moved here, St. Augustine was a much smaller town, and Flagler Hospital was a community run hospital. And it was a wonderful experience. It always has been. The administration has been great. They've really supported the community. And obviously the town has grown, and we have been busting at the seams. The psychiatric unit is often full and overflowing into the emergency room. So as things have grown, it's required a greater level of infrastructure. And recently, University of Florida purchased the hospital. So I think we were all nervous about that. Of the potential suitors, I think it was the best outcome. And it's been a nice transition so far. Obviously, any change like that is difficult. We're changing the medical record system in the hospital. That's always painful, reorganizing things. But overall, I think it's a very good change, and University of Florida is going to bring a lot of mental health resources to the area.
Well, I can tell you we were very nervous at home again because Flagler was the lead agency for the homeless and the continuum of care, and University of Florida said, yes, when they wrap their arms around that, we're like, yeah, that's the one we want. Yeah. That's the group we want, as you said, in the suitors. But Lena, to get back to you, obviously with your wonderful accent, you're not from here. When did you land in St. Augustine? And tell me about that transition since you've gotten here. You said you were in the Army, but how long have you been here in St. Augustine?
I've been in St. Augustine for about 2 years or so, maybe 2.5 years. And before that, I was down in Ormond Beach working in Daytona, still for SMA Healthcare. And then in America, I've been here for about 8 years this year. And actually, I've just become a citizen last month.
Oh, congratulations.
Thank you. Yeah,
That's
it feels
awesome.
good. Yeah.
That is awesome.
Yeah.
So in trends in the mental health world, and I'm throwing this out to both of you guys so you guys can, trends in the mental health world, do you see a positive trend? Let's do negative trend and then a positive trend. What do you see as a negative trend that we need to kind of keep our eyes on and say, let's keep our eyes right there? And then what's a positive trend of let's boost this one up and it can help. So I kind of threw a two-parter at you there. So let's do the negative trend that we really need to keep our eyes on and the positive trend that we can kind of help our loved ones around us, because we talked a little bit about depression there and being there for them. So what's a negative trend and then a positive trend from both of your perspectives?
Go ahead. Took a deep breath. I felt like there was something profound coming.
Sorry,
I don't pressure for a really good answer now.
I don't always ask the easiest question, but it's the
this is a great question.
This is a great question.
What do you think?
Honestly,
Negative trend.
What do I think of a negative trend? I think honestly, nutrition, lifestyle, and diet. I think to me, there's again a lot of evidence regarding the gut microbiome and the link between the gut and the brain. And what we eat truly has a significant impact on how we feel. So for me, I'm really keen on education about nutrition. I did a brief little course in nutrition psychiatry and learned a lot about nutrient deficiencies and how that can affect the brain. And how we can really fuel it with what we eat. And I think there's a lot of changes that need to be made with regard to like the standard American diet. Yeah. So that would be a negative trend, I guess, if that answers the question somewhat.
All right. I'm going to go with your negative trend, and then we'll go back to the positive.
Sure.
I would agree with it. I think that's a two-part answer.
Yeah.
One is the clinical side of things, and the other is the business side of things, the business of medicine. Clinically, depression has been climbing. And the number one cause of depression is low-grade chronic stress. Mm-hmm. Look at our lives, right? We are now living in the information era, right? We went through like the Stone Age and the Ice Age. We're now in the information age. We're bombarded with information all the time, and our brains are just not evolved to handle that much influx of information. Our lifestyles are very busy and fast. We don't have enough downtime, and that chronic low-grade stress is leading to increases in depression. I think that's been a very obvious negative trend. At the same time, the business of medicine has become somewhat of a dirty business. Mm-hmm. Insurance companies have made it very difficult for private clinicians like Lena or myself to have our own practices. And myself and my partner, Dr. Lewing, have worked very hard to keep a clinician-owned practice, because what you see happening is businesses and business guys owning and running practices, and sometimes that becomes very money driven, and the focus gets lost with regard to taking care of patients. So I think finding that balance is difficult.
And in my mind, the insurance portion, I was wondering, the way insurance is set up, it's not like they kind of herd you into a certain category, and it might not always be your best location. And I'm glad you touched on that, because in my mind, as a non-professional, I could see someone going, my insurance doesn't cover this guy, but I have to go to this guy. I don't like this guy, so I'm just not going to go. So because that's kind of the way insurance is today, and it's an unfortunate thing.
And you have to advocate for yourself, and you need a physician who will advocate for you, because insurance companies don't want to pay for some of the newer treatments for depression, for example, that have less side effects and can be more effective. So somebody has to fight for the patient, and that takes time and energy to do that.
All right, let's go to the positive. What's a positive trend that we need to kind of lean into and say this is starting to really step in the right direction? Because what the practice you guys in is always going to be a constantly evolving.
Yeah.
Especially the last 10 years.
Massive change. So like, what's a trend right now where you're like, hey, I'm kind of leaning into this one a little bit. So I'd like.
Again, I think it kind of interlinks with the negative side. I think there's, there's a lot of political stuff going on right now with changes to dietary guidelines and stuff, and banning certain food dyes, awareness of like chemicals that we're ingesting and toxins, and also the trend in psychedelics, which is seems to be becoming more and more openness about
more acceptable.
Yeah, less like stigma, and I think the more education and knowledge that people have, then the more
Because everybody's wired a little bit different. So,
and it's not for everybody, that kind of therapy, of course, but
finding that right recipe, I guess, is where it's at.
Yeah.
So what about you, Dr.
So
Broder?
from a treatment perspective and more of a psychopharmacology perspective, we have made a major change in gears over the last couple of years with regard to how we treat depression, and we've been much, much more successful and effective at treating it. Since the 1940s, our theory for treating depression, medication-wise, was serotonin. We have been in a monogamous relationship with serotonin. You've heard of medications like Prozac or Zoloft, but they boost serotonin. And not to throw the baby out with the bathwater, those treatments are very effective for about a third to a half of people. But over the last decade, we've been focusing on a totally different area of the brain, and that is glutamate, a totally new neurotransmitter. And we're using neuromodulation, like transcranial magnetic stimulation, kind of like an MRI machine, sort of, to treat depression. We're using ketamine and derivatives of ketamine that we now think can actually help the brain regrow tissue and make new nerve connections to treat depression much faster than we've ever been able to do it before. And then the world of psychedelics and psilocybin, which is right around the corner. In terms of mainstream medicine, as Lena mentioned, it's been around for centuries in humanity, but we're now finally focusing our attention, mainstream medical use of psilocybin, magic mushrooms, basically, to treat depression, and the results that we're seeing are really quite phenomenal.
And is that just being the Gen X novice that I am, is that what when I'm hearing a little bit of microdosing? Is that similar to what we're talking about?
We're talking about macro dosing.
So macro dosing.
Full dosing.
But there is some evidence that microdosing is also beneficial.
Okay.
So microdosing is usually with psilocybin or LSD.
Okay.
And all of this, of course, is not legal in the state of Florida. So when I practice this, it's in Oregon, Colorado, certain areas where it's legal. But it's coming. I'm sure it's coming.
No. I mean, and I know some successful people that believe that, okay, this really helps me out in a very high stress jobs.
Yeah.
And they're like, okay, it just kind of lets me take a breath and lets my brain focus on what I need to focus on. But you're talking about regenerating, or how does that work with the regeneration of the brain cells that you're talking about?
Years ago, we thought depression was very episodic. You get depressed, you get better, you're back to normal. And we're learning now that's not necessarily true. The longer somebody stays in a depressive state, the harder it is for them to get back to who they were before. And the reason for that is depression appears to be more of a physical or a cellular disease than we thought it was. So when people are under a lot of stress and they're depressed, the neurons in the brain actually start to die, and we lose structural support in the brain. We can see this. You can see MRIs of chronically depressed brains, and parts of the brains are actually shrinking. We call that pruning, pruning a tree. And when we use medications that target the glutamate system, we're seeing now that we can regrow some of these neurons and make new connections between neurons, and that's arborization or neuroplasticity. And there's been evidence that the adult brain can change and be neuroplastic dating back 25 years now, with research that was done on taxi cab drivers in London. Actually, really, really interesting stuff. But we're really leaning into this concept of, hey, what can we do to really improve the brain from a psychopharmacology perspective? It's fascinating.
And because the U.S. has been at war for over 20 years now, PTSD is a real thing. We have Veterans Village with Home Again. And one of the things that we've seen with our residents, they were living on the street. They kind of, were going from, carrying a bag from here to there, and now they have their own place. But the socialization of them, where they can lean into somebody in like circumstances, has majorly changed, these men and women and how they look at the world. Like, they're standing out front talking to their neighbor who's now one of their best friends. That didn't exist 2 years ago. So the socialization with the depression and being there for your friend, can we talk about, like, just make sure they know you're, as a friend, you can be the number one person that could save this person from a drastic situation. Can you talk about the socialization of depression and the importance of that?
You want to take that one? Has been in the military and had a lot of experience with.
Yeah. I mean, it seems like you guys in America really do look after your veterans pretty well, especially comparatively with Britain and other places, I think. So, yeah, I mean, I really agree with you. That's such an important part of life generally, social connections, feeling supported, feeling cared for. Yeah.
I think it's part of the reason we're having so many problems is with all of the technology, we're becoming more socially isolated. We feel more connected, right? Because you can pick up your phone and your friends are all there and you feel more connected, but we are more disconnected now than we've ever been. So I can't agree with you more. Having that real bond that somebody else
a true conversation.
Mm-hmm.
Because some of these guys weren't having and women weren't having true conversations, and I think even in like middle schools and high schools, that dynamic's changed. Like, you leaned on your buddies in high schools and middle school when I was
I remember
when I was growing up, and now you lean into your technology. I did a field trip with Blake when Blake was in 8th or 9th grade, and it was a bus full of kids, and I was like, oh my gosh, this is going to be so loud, and thinking back of when my trips and stuff were,
everyone's on their phone,
and everyone was on their phone.
I know,
and they weren't even. I mean, they're literally sitting beside each other, texting each other, and then they look and they go. I was like, oh, just talk. He's right there. Just talk to him.
And that's the thing. You can be around so many people, but still feel lonely. So I think like true meaningful connection with people who are fully listening and present is
this
really
technology
important.
Hijacks our brains.
Yeah, it sure
our
does.
brains have thousands of years of evolution in these systems that are designed to give us reward for hugging somebody and going out with your friends and having sex and all the normal things that we do to connect. And now this technology has hijacked those primitive pathways and pulled us away. It's
and Blake's brother Ty, the power of a hug, and we Ty and I, we always his body will get a little too overstimulated, and he's pretty much nonverbal, but he's just a lot of love. So we do a 20-second hug, and we probably do a 20-second hug 5 times a day, just to kind of bring the power of a hug is amazing. And people just don't, we kind of lost that contact.
We call it a therapeutic hold.
Therapeutic hold.
That's the medical term for the hug.
Okay, therapeutic hold. Yeah. So I'm going to stick with my 20-second hug, but I like the therapeutic hold. But thank you guys so much. We have to do a couple more little pay some bills and go through some comments.
No, I was excited to hear you talk about Fidus Roofing. They're putting a roof on my house right now. Troy vouches.
They're wonderful people. They really are.
I've been so impressed.
They're wonderful people. James over there, and they've been with us for a long time. So, all right. But thank you guys. We're going to go through some comments. You guys stick around for us for just a little bit more,